The findings of this comprehensive study shed light on the urgent need for structural improvements to protect the health and well-being of sex workers in Germany. Despite common misconceptions, sex workers are not a uniform group. Their experiences, identities, and working conditions vary widely. However, what unites them is the shared reality of societal stigma, legal challenges, and economic pressures, all of which significantly impact their access to healthcare and personal safety. This study, conducted over 2 years with direct participation from sex workers themselves, provides critical insights into their needs and proposes actionable recommendations to ensure that their right to health is respected and upheld. The study challenges the oversimplified narratives often found in public discourse, which tend to categorize sex workers as either fully autonomous professionals or victims of coercion. The reality is far more complex. Many sex workers see their profession as a necessary means of survival, a financial strategy, or even a chosen career path. However, despite their agency, their ability to prioritize their health is often hindered by systemic barriers such as financial instability, legal uncertainty, and exposure to violence. Without addressing these foundational issues, health interventions alone will not be sufficient to improve their overall well-being. One of the most alarming findings is the increasing demand for sex without condoms, putting sex workers at heightened risk of HIV and other sexually transmitted infections, STIs. Economic hardships force some into situations where they feel pressured to engage in unprotected sex, either due to financial incentives or fear of losing clients. This highlights a dangerous dynamic where financial precarity directly impacts personal health decisions, increasing vulnerability to infections and long-term health complications. Additionally, the practice of stealthing, the non-consensual removal of condoms during sex, was reported as a significant concern, further exacerbating the risk of STI transmission and emotional distress among sex workers. The study also reveals a critical gap in knowledge and access to preventive measures such as PrEP, pre-exposure prophylaxis, a medication that significantly reduces the risk of HIV infection. Nearly half of the participants had never heard of PrEP before the study, and many others had only a vague understanding of it. While some expressed interest in using PrEP as an additional safety measure, concerns about potential side effects and accessibility remain major obstacles. Increasing awareness and making PrEP more readily available in public health services could offer a vital layer of protection for those who choose to use it. Beyond sexual health, mental health emerged as a significant concern. Many participants reported experiencing psychological distress, often linked to social stigma, discrimination, and the persistent fear of violence. The criminalization of aspects of sex work creates additional anxiety, particularly for those without legal work permits or proper registration. Fear of law enforcement prevents many from seeking medical care or reporting instances of violence, leaving them trapped in cycles of vulnerability and harm. A major barrier to healthcare access is the lack of health insurance coverage for many sex workers. Without proper insurance, routine medical care, preventive treatments, and emergency interventions become out of reach, forcing many to delay or forego essential healthcare services. Ensuring universal access to health insurance, regardless of immigration status or work registration, is a fundamental step towards safeguarding the health of all individuals, including sex workers. Despite these challenges, the study also highlights promising pathways for improvement. Public health services, particularly free and anonymous STI testing provided under the Infection Protection Act, play a crucial role in protecting the health of sex workers. However, these services need to be expanded and made more accessible to ensure that all sex workers, regardless of their legal or financial status, can benefit from them. Outreach programs, mobile health services, and peer-led initiatives could help bridge existing gaps by delivering healthcare directly to those who may not otherwise seek it. To create meaningful change, structural reforms are necessary. First and foremost, policies that criminalize sex work must be reconsidered, as they push sex workers into unsafe conditions where their health and safety are compromised. Decriminalization, coupled with protective labor regulations, would allow sex workers to work under safer conditions, access healthcare without fear, and report abuse without the threat of legal repercussions. Additionally, targeted social support services, including financial aid, legal assistance, and housing programs, could help alleviate the economic pressures that force some sex workers into riskier situations. Expanding peer-to-peer networks and creating safe spaces where sex workers can exchange knowledge and support each other would further empower them to take control of their health and professional lives. Client education also plays a crucial role in fostering safer and more respectful interactions. Awareness campaigns aimed at clients should emphasize the importance of using condoms, respecting boundaries, and understanding the health risks associated with unprotected sex. Encouraging responsible behavior among clients could significantly reduce the risks faced by sex workers and contribute to broader public health goals. Ultimately, the findings of this study serve as a wake-up call. Improving the health of sex workers is not just a matter of individual responsibility, but a societal obligation. Without addressing the systemic issues that hinder their access to healthcare, safety, and basic human rights, public health interventions will fall short of creating lasting change. The recommendations outlined in this study provide a clear roadmap for action, one that policymakers, healthcare providers, and advocacy organizations must urgently follow. The need for immediate and sustained action cannot be overstated. Sex workers deserve the same rights and protections as any other workers. By investing in harm reduction strategies, expanding healthcare access, and enacting legal reforms, society can take a significant step toward ensuring that sex workers can lead safe, healthy, and dignified lives. The question now is not whether change is needed, but whether the political will exist to implement it before more lives are put at risk.